Richard Clark. Welcome, folks who are joining. We are having people dialing in, as they used to say, as we speak, and we will be starting in just a few moments. In advance of today's presentation by Katie McCurdy, who is the founder and designer for Pictal Health, I thought I would take a few moments to briefly introduce the Health Data Consortium and to tee up today's discussion. If we can go to the next page, some rules of the road and some ways to comment or share your perspectives and impressions of today's event. On social media, you can access the Twitter handles for both Katie and MHDC are presented, and you can also see the handle for Katie's organization, Pictal Health. And we've added the event hashtags of MHDC Pictal and Mass Health Data. Rules of the road. Everyone will be muted during the presentation, so please enter your questions in the Q&A window. The chat is disabled, so we want to get Q&A into the queue, and encourage you to enter any questions at any time, and we will answer them, and we will answer over the course of today's discussion. We are recording today's webinar, as all of you know, upon entering, and the video of today's webinar will be available to MHDC members within 3 business days. And lastly, we'll open up a poll. It's 2 questions at the end or near the end of today's meeting. So please take the time, however brief, to give us your thoughts, your opinions, so that we can continue to improve our webinars and our presentations to the community going forward. Next page. For those of you who don't know MHDC, we are a not-for-profit 501c3 corporation. We are the only organization of our type in the country. We bring all members of the health data economy or ecosystem, if you will, together to solve problems that are too big to solve alone, too costly to solve alone, or where collaboration really advances the quality and the effectiveness of the kinds of things that organizations in healthcare need to do, many of which are driven by regulations, some of which are driven by market forces. We are independent and unbiased. We are not an association in the sense that we do not represent any particular organization or entity within healthcare. Our expertise is in health data standards and regulations, as well as in the technology of interoperability, among other factors. We have a local focus, but we have an increasing national influence. And we pride ourselves on invention, innovation, and incubation. We really want to provide services to our members in our community that advance a patient-centered health data system, something that Katie, I'm sure, appreciates, and will tell her own version of that story as we get into her discussion. Next slide. What do? We have data governance services headed up by Janice Karen, our Director of Integration Technologies. This is where we work around how do organizations in healthcare get their data, their systems, their exchange of data in order to be able to support a patient-centered health data system as mandated by regulations and increasingly as demanded for by patients. We offer exchange services. We merged with the New England Health Exchange Network in the middle of this year, expanding the portfolio of data-related services that we have for members. And we provide analytics services with a web-hosted analytics package that includes, among other things, measures of equity, inclusion, as well as low-value care and the like for hospitals and health systems in our region. We provide the Vantage Point series, a series of interviews with leaders in healthcare. We've done 4 of those this year. We have a forum that is for CIOs, CTOs, CXOs, who want to understand from industry veterans and leaders what's happening from an insider's perspective. What are the things that really matter on the ground in managing healthcare organizations? And lastly, we pride ourselves on webinars. We've done over 30 this year. We've had terrific attendance, and we place a considerable amount of pride and effort in doing what we can to educate and inform our community. And with that, we can introduce or allow Katie, you to introduce yourself, and then take us through Pictal Health and your visualization innovation.
Okay, sounds great. Thanks so much, Danny. And I have an introduction that is kind of incorporated with my slides. So I'm going to go ahead and share my screen. And how's this looking?
Looks terrific.
Okay, great. So you mentioned patient-centered health data systems in your introduction. And I think what I would like to present today is about my personal background, my work with Pictal Health, which is an organization I founded to help people tell their stories in a more visual way. And I think it's one version of a vision of a patient-centered health data system. And I know there's all kinds of different roles on the call today, from designers, researchers, clinical informatics, clinicians, data analysts, even my own mom, hopefully, if she was able to get in. I would love to hear your questions as we move through. And again, Denny will interrupt me with questions when they come up, but that's totally fine. And I think this presentation is about 40 minutes, but we'll stay on and take questions for as long as they last. So let me jump in. So I currently live in Burlington, Vermont, but 10 years ago, I was living in New York City, working as a designer at a large agency. And I started experiencing new unfamiliar symptoms that didn't seem to belong to my existing diagnosis, which is an autoimmune disease called myasthenia gravis, for anyone who's familiar. And so if anyone's ever lived in New York and tried to get healthcare, it's pretty complicated. I found myself kind of jumping around between different providers, between different types of specialists and holistic providers. And I just felt like no one was really hearing me or seeing the big picture. I was very frustrated and scared. And, I'm sure everyone on this call can think of someone who's been through something similar where they've had some sort of unsolved health issue and have really felt like they're not being heard. And this is actually a pretty big problem in our country. Every year, there are 12 million people who experience some sort of diagnostic error, whether that is a misdiagnosis or like a lack of diagnosis. And to me, there's a few things that contribute to this problem. One, there's just not enough time in our doctor visits. There's different studies on this, but it always seems to average out between like 12 and 17 minutes. It's just not enough time for a complex patient to tell their whole story, remember everything they wanted to say. And it's not enough time for their provider to really take in and make sense of a very complicated story. So as humans, we can only hold about the last 4 things we've heard, the four pieces of information we've heard, or the last 30 seconds of anything we've heard in our short-term memory. So if a complex patient comes in and starts, has more than 4 issues or 4 things that you need to know, as a provider, you're bound to lose track of some of those pieces of information. So we just can't hold a whole complex story in our head. And this comes at a high cost to patients, not only lost time while waiting for a diagnosis, For me, I went another 2.5 years before getting a second autoimmune diagnosis of Sjogren's syndrome. So there's kind of that gap of time while people are having symptoms, are having this uncertainty. They also face higher out-of-pocket costs and even higher risk of death. So at the time, 10 years ago, and I was working as a designer, and I still work as a designer. And I found that meetings were always more productive when I could make them visual in some way. So I had this aha moment as I was prepping for an appointment with a very expensive holistic provider that I could make better use of that time with him by bringing a visual in to share with him and get my story out more efficiently. So this was like a very early version, V1 of my first health timeline that I created. And, this was mapping out symptoms, some medications I had taken, some kind of key milestones. This is sort of the rudimentary version. And I found that this early timeline did help me tell my story more effectively and, kind of point things out as I sat in the visit, make sure I didn't forget anything. And so I used that timeline basically every first visit with a new doctor for the next few years. And, word for word, a bunch of doctors said, this is the coolest thing ever. And other doctors said, I wish my health record looked like this. So I had some positive reinforcement from doctors and also other patients who I shared with, and I shared this online as well, and got a lot of comments on it. So I started Pictal Health about 3.5 years ago now, and the purpose is to help people with complex health issues to tell their stories in a more visual way, so that they can be heard and understood, working with their doctors to get the right diagnosis and treatment. So this has been intended as a collaboration tool and a communication tool between patients and doctors. And I've worked with 56 patients so far, and 10 of those were a 10-patient project with the VA, with veterans who had memory problems along with chronic health conditions. And so I've worked with people through this very manual process up until today to interview them, listen to their story, and help them synthesize it. So that involves me getting on a Zoom call, usually with a person, spending 60 to 90 minutes with them, interviewing them, really trying to get all of the details, all of the diagnoses, all of their injuries, just everything that has happened in their health history. And I've found that in that, say, 90 minutes, we've been able to get most of their health history covered. So it starts with an interview. Then I've been mapping out their health journey visually and putting together a report, like a written report, so they can bring both to their doctor. And this has currently been a manual process that I'm working on automating. And then I prep them for their appointment to kind of bring these documents into their appointment with their doctor. And this, the type of people who have kind of come to me, have found me, tend to be those with mysterious, rare, complex conditions. So people with unsolved health issues, often people with multiple chronic conditions, and more on the autoimmune or rare disease side, then those seem to be the people who need help communicating with their doctors more than, say, I haven't had a lot of people with like heart disease and diabetes reach out to me for help. So it seems to be kind of the less understood conditions, those kind of the weird things like Lyme and IBS, autoimmune. And
Katie, I have a question for you.
Yes.
I'm sorry to interrupt, but we agreed that I would be doing this periodically.
Please.
So
yeah, thank you.
Question one is, do you find that telehealth has derailed the ability for patients to use these visuals? I know you have a smaller sample size, but do you think telehealth is impairing or impeding the use of these visuals or enhancing it? What if the visit has no visual component, like a phone or a voice visit? what are some of the things that you might recommend, and what are your
Yeah.
thoughts about that?
So I can speak to that from my own experience. Telehealth has made this process more seamless. So with my rheumatologist and my neurologist, recently I've had some new symptoms, and so I've had appointments with them, and I share my screen just like this, and I have a visual. Sometimes it's just a drawing, and I'll take a photo, put it on my computer 10 minutes before the call, pull it up. And so it's kind of using the tools that we use regularly in video meetings. I think it's kind of facilitated the process of sharing your screen, zooming in, zooming out. Normally, in an in-person visit, it is really nice to have a paper version. So because it kind of, the doctor and the patient can kind of collaborate or gather around the paper. So it's not like the doctor has all the power showing something on their computer. It kind of gives, I think, the patient a little bit of power in that relationship to say, okay, here's what happened, and kind of point to things. It's not, obviously paper is not perfect. It's not a long-term solution, but I think my hope is that with moving more to telehealth, these types of visuals could be more seamlessly integrated into the visit, and then subsequently into the record, which is kind of one of the big challenges.
Thank you.
Yeah, sure. So what I want to talk through today are kind of some kind of categories, I would say, of benefits that I've seen result from this process. And the first is to help expedite diagnosis and treatment, which is the intent. Also to make the patient's whole story easier to understand, and we'll talk a bit about what I mean by whole story. And then helps patients to be heard and seen. It's a very emotional side of this work. So let's talk about expediting diagnosis and treatment. And first, I just want to walk through kind of what are some of the components of these visual timelines and these kind of diagrams, and how's the data different from what exists currently. So I'll break this timeline down. This is actually a very simple version. Usually they're much more complicated than this, but this is an easier one to look at. So at the top here, you see these purple area graphs, and that's a person's symptom history. And importantly, this is not something they've been tracking over all these years, like since the 90s or since the 80s. This is the person's memory of how they felt over time. So it's like an artistic representation of their memory of how they felt. And people tend to really remember those times when they felt horrible, or they had a really bad flare, or when they were feeling better. And so I usually, after speaking with someone, I put together a rough draft of these symptoms, this timeline. Then I meet back up with the patient and share my screen with them, and they direct me and tell me how it should change. So the patient is the art director, and gets to kind of craft what this looks like. On the left, you see this little red bubble. It says mono. Often, almost always now, I have a swim lane for injuries and illnesses. So things like, some people have chronic infections, mono, major injuries, car accidents, things like that. So that's what that red bubble is. Below that, you see blue, which are diagnoses. And some of them are starred. In this case, this person had a few different diagnoses, and she felt like these two were particularly important to her story. So we put stars next to them. And since this has been a manual process, we can do whatever we want in these visuals, and try different things. And over time, working with many different people, we start to kind of hone that process and figure out what works. So then the yellow colored bubbles here are life events, and the size is the importance or the stress level of the event. And so this is a way of capturing stress. And, we know stress has such an impact on our health. So in this case, you see this person had the death of a child the same week as the birth of a child. And so she just had some phases of pretty extreme stress. And then below that are treatments the person has tried. And these are, as you can see, not only medical treatments like antibiotics, but we also capture any intervention they've tried. So supplements, vitamin C, saunas, often dietary changes, things like that. So anything the person has tried to help with their symptoms. So overall, this gives kind of a holistic view of where someone has been, from birth until today. So we really go all the way back in time. And then, you can see where they've been, what they've tried. And we start to see trends too that can be hard to spot otherwise. So looking here at some of the life events, you can see that when she moved to a moldy house, it seemed like her Lyme-like symptoms worsened. And then when she had this major life stressor, her heartburn seemed to get worse. So it can be hard to just hold all of these things and create this kind of a picture in your brain. So this type of display can support those kind of insights. And then in this example, I also noticed that as she started seeing a new doctor in 2011, 2012, she started trying a lot of different treatments, and kind of you can see how they stack up. At the same time, her symptoms were slowly reducing. And so this gives some reinforcement that the treatment regimen seems to be making a difference in this case. And so it can hopefully kind of reinforce people to stick with what they're doing and see that it's helping them. In addition to the timeline, I have almost always worked with people to create these symptom maps on the shape of a body. And I actually started doing this early on for myself, just kind of drawing a body shape and then kind of drawing how the symptoms felt as a way to communicate again with doctors during short visits, make sure I remembered all the symptoms. And some people have 40 or 50 different symptoms. They really have a complicated situation, and it can be difficult for them to remember in a visit to say all of those 40 or 50 different symptoms. And it can really be difficult for a doctor to hold all of that in their mind. And then we do start to see some patterns as well. I've had doctors say this type of representation is helpful to see, like clustering of symptoms, like are they clustered around the head, or are there symptoms that are just happening on one side of the body or another, like this person is experiencing. So it's, again, a tool for the patient to communicate and also for the doctor to absorb. And I'll say also, as a patient with lots of weird, complex symptoms, this is also a way of feeling a sense of control over the symptoms, especially when there's something new going on that can be kind of scary. There's something about just even taking a piece of paper and drawing on the shape of a body gives me a sense of like, okay, this is what it is. And now I know, and I can bring this to my doctor, and hopefully we can troubleshoot this. So,
question 2, Katie, have you or your clients run into the situation where a doctor or a clinician responds to this and says, I want to just look at 1 or 2 things at a time? This covers a range of things. Do you run into that on occasion, or do you find that clinicians are more responsive or receptive to being shared information that covers a range of potential causes and symptoms and life events?
I'm trying to decide how to answer because, well, what you're talking about is such a common complaint that I've had myself, or that I've heard other patients complain that, okay, I go in with heart palpitations, suddenly I'm seeing a cardiologist and they only care about the heart palpitations, but no one's seeing the big picture. This happened to me. And so what I could say is I do think this approach has helped providers to see to zoom out, because they can't help but see the big picture when they're presented with an image like this. Even if their specialty area is only the heart or the gut or whatever it is, they can't help but understand the complexity and start to see how some of these things, might be related, or make sure that the patient is getting the care they need for all of the other things that they don't treat. I have not heard directly from clients that they've brought this to a doctor and then the doctor said, well, I don't care about all that other stuff. So I'm not sure if it's happened or not. Yeah, I'm not sure. I don't think that's happened. Yeah, but I have, and I have some quotes in here from providers. One that's not in here, a doctor at Stanford in the consultative medicine clinic, which is a clinic that deals with people who have mysterious illnesses. I worked with one of her patients, and she said that this gave her the map to the person. She was especially talking about the timeline, but also the body representation. It gave her the map to a person, and so she could kind of see the terrain, and she could decide where to zoom in and ask questions or get more detailed. So
okay, thank you.
That's what I would hope.
That's good to hear.
Yeah, so far. So this manual process that I've been describing has taken me usually in the 8 to 15 hour bracket, sometimes over 20 hours for very complicated people. But I am, so I'm going to save most of this product talk until the end, but I am working on a more scalable product. So I phased out my work with individuals a while back and have really been focusing more on the digital product to automate this. So that's sort of my background is user experience design. So I've been focusing on that. And so, feedback from providers that this is a functional medicine provider in California who that patient whose timeline I shared with you a few minutes ago, he was seeing her and he said, this helps to jumpstart the conversation. So he was for a period of time referring patients to me to go through my process before they came in for the intake with him. I think I did that with 6 or 7 of his clients. So speaking of expediting diagnosis and treatment, this is actually the first person I ever worked with. So the timeline looks a little bit different, but just as background, he was experiencing burning and pain from the time he was a young child in his abdomen, and then he had bleeding and was like dangerously anemic. He had been to many, many different doctors over the past like 3 or 4 years, and he just felt like he wasn't getting anywhere. And one of the problems was doctors kept telling him to try the same thing, to try increasing his dietary fiber. And he had tried it multiple times and it didn't work. So this was helpful for me to know. And we, in the document we prepared for his doctors, we created a section of treatments that he's already tried that don't help, so that we could try and reinforce that this has already been done and I really don't want to do this, and kind of put that down on paper, and why, what's the evidence. So this was kind of a structured part of the paperwork he brought to the doctor, and this was the result. He felt that the doctor picked up the conversation where he was at, didn't ask him to go back and try all these things that he had already tried. And so he was able to kind of move forward in his diagnostic journey. And he finally did get a diagnosis. He had a procedure, and now he's like very healthy and running marathons. And so this is lucky for me. This is the first person I ever worked with who's a friend of mine. And so it was a very good result. And he was being seen at Dartmouth. And when he went back for his follow-up, the doctor came into the room holding the timeline, which was paper. And so that was weeks after his prior visit. And I don't know where they were storing that paper, because we're all, doctors' offices are all digital these days. So to me, it spoke to the value of that timeline and that paperwork that the doctors found even though it's probably not HIPAA compliant, but found somewhere to stash it and then bring it into the room for the next visit.
As long as they locked it up when they weren't using it, they're fine.
Yeah, sure. Yeah, that's true. That's true. Yeah. Okay, so then I learned that working with him, that idea of like, okay, what helps me, what doesn't help me. And so this is just kind of another person that I worked with all of the words stripped out of the timeline, but just to show you the idea that I started color coding treatments on the timeline so that we could get a quick at a glance view. Does this treatment help? Am I not sure if it helps or not, which is often the case, or did it not help in that it wasn't effective? And the red also we have used for if they have major side effects from that drug or that intervention. And so I've heard from doctors that this is also a helpful tool for them to understand what has worked or not worked in the past and what should we not attempt to try over. It's difficult, I believe, in the EHR to get a view like this. And so another patient who I worked with actually here in Vermont, who just want to include this quote, was having very mysterious symptoms and wasn't able to get a diagnosis and had a very complex health history, was also able to finally get the right tests and get a diagnosis. And so, there are cases where this has been a very straightforward process. People work with me, they go to their doctor, it sets them on a new path and they get to a diagnosis. It's not always the case, but I will talk about some other benefits of this process that I think make it worth it. And actually, before I jump in, Denny, are there any questions that you want to?
Yeah, I have a couple of them. Katie, in addition to the visual, do you find that the graphs help people to start talking more easily? So as part of the big value, as a conversation starter, patient engagement, and will you be discussing your techniques for getting patients to start talking more about their symptoms, their diagnoses, their life events, all the dimensions that you capture in your visualization?
Yeah. So to start talking, helping patients to start talking in the doctor-patient visit, I think that was what the person probably meant by that, to help, when you sit down and the doctor says, what's going on?
You get an attack of white coat syndrome.
Or like, where do I start? There's so much. And so what I've heard is that the visuals, so a doctor could sit down and kind of, the visual does speak for itself in a way, but the patient has, there's key things. And when I kind of coach people to use these documents in their visit, we talk about like, what are the really important things to point out? Like, are there moments that seem really important? Like often, if thinking back, there's like an infection that might have kicked off a whole process for someone of symptoms. So kind of pointing that out. Or for me, I always, when I'm seeing a new doctor, I want to point out, here's how I was diagnosed and here's the test and here's the result, because I don't want to get that test done again because they shock me and I don't want to be shocked. I don't want to have my muscle. So there's things that that I think having this visual, we can kind of scan it together, but then the patient also has clear things that they can, moments that they can point out. As far as, and it is like a conversation starter, and I think it prevents doctors from having to ask quite so many questions, because a lot of what they might ask is there. So they can start asking questions about what's there and get deeper instead of asking questions to try and build this picture in their mind.
Yeah, starting from scratch all over again.
Yeah. As far as with me, when we have our conversation, my strategy I send people a document like intake paperwork to fill out, which is not fun. And so most people don't get through it. And many people don't even start it. And that's okay. I understand that for a lot of people, it's difficult to sit down and face your health history. I think there's kind of a mental block there. And so when we get into a session, into like our intake call, I just start going through my template and asking questions. We start with, and I have a template that's free and available online. That's like a Google Doc template. And so people can make a copy and fill it out themselves if they want. But we work through, what are your top goals? What are your top concerns? What do you really want your doctor to understand? Like, what are you frustrated about? And then just standard, like, what are all your diagnoses, your injuries, your illnesses, life events? And so we just start working through that. And I type while listening and just try and get all of those pieces of information. And people talk in a very circular way. They remember things in a very circular way. No one thinks like a computer and just remembers everything in order and by category. So, they'll drop clues while they're talking, like, oh, that was right after my accident. I'll say, oh, what accident? And okay, let's go log that. So I'm kind of jumping around in this document, taking a lot of notes and being a facilitator, just kind of helping them to draw out the story. And yeah, go ahead.
No, it's just that that's very helpful. One of the questions we have is, do you capture things or do you see in the histories that you've rendered interventions, treatments, medications, non-pharmaceutical interventions, whatever? Do you find that you see things that work for a while and then they stop working? Has that occurred in your experience, or do you see that happening?
Yeah, I can think of one person in particular but it didn't take the timeline to know that. But when she described her history of pretty severe autoimmune, she had tried a number of different like medications and infusions. And on her timeline, there was a period of time where she was on a new medication and her symptoms went down to almost nothing. And she was doing great. And then I think her insurance stopped covering it. They made her switch. And then her symptoms went back up. And she knew that because she was living it. And so it was easy to make that connection for her. But that's a case where I could think of where we could also represent that on the timeline. So there's to me a kind of a difference in keeping track of symptoms to better manage symptoms. And it's kind of symptom tracking to me is kind of a separate challenge and might include like more daily logging of, how your body's feeling. And there's many symptom tracking tools out there that do that pretty effectively. I have not focused much on that, just knowing that there's these other tools out there. It's a different design problem. It's a difficult habit to keep up with symptom tracking. And the hole that I saw was more in this kind of life story mapping and helping people represent that.
One other question we have is, when you did this with patients individually, you said that you're stopping doing that. You're moving into a more scalable application that people can use. How did they just paid you a fee for doing this? This wasn't covered by insurance or anything like that. This was basically something they wanted to do, and that was a service you provided them directly. Is that right?
Yes, I worked with people mostly directly. So those 10 patients, that was like an innovation project through the VA. So the VA paid for those. About half of the people I worked with were pro bono, just to get experience or to help someone out. And then, so the other half were paid clients. So I would have them like fill out an agreement and kind of, go through the whole client relationship thing.
The whole client relationship thing, right?
Yeah. So, but
Well,
ideally, insurance. So I think that this type of service or this tool should be reimbursable because it's like a tool that's a way for patients to store and communicate about their health records. So it should be reimbursable for like HSA at least.
absolutely. And insurers talk about wanting, to have and not just insurers, providers also, but having a longitudinal health record, something that may be less stringent on the very, very detailed information, but much more focused on sort of the life course of a person and their health. And I think this would be something that insurers would see as an invaluable service. It reduces the amount of redundant physician visits. It reduces the amount of redundant treatments and tests and things like that. So hopefully we have a number of them on the call and they're writing notes furiously as we speak.
Yeah. I mean, that is, I think those benefits you mentioned of reducing redundancy in the system and, showing like I've mentioned with here's how I was diagnosed. I don't want to do that again. I hope that this tool would be effective for that. I need the evidence for that, but it's kind of common sense.
One other area, and then I'll let you continue. One area where this seems to be a good fit for a longer term period, not the symptom checker that you described earlier, that different domain, but is in behavioral health and mental health, where people are often on cocktails of antidepressants, anti-anxiolytics, antipsychotics, Lord knows, off-label treatments. And being able to, for example, taper someone from one medication to another is a long-term problem. It has to take place over, depending on the prescription, over a long period of time, sometimes a year or longer. And this would strike me in the world of, mental health, behavioral health, psychopharmacology as a really valuable tool for patients to record, not necessarily in a journal daily, the arduousness of a symptom tracker, but since I've been on this new medication, the following things I experience differently, and with the emphasis increasingly being that mental health is health as much as physical health. This strikes me as a very good vehicle for that. What are your thoughts about that?
Yeah, I totally agree with that. And I have some examples of mental health to show you in a minute, but I had a chance to run this concept by a psychiatrist in the hospital, as hospitalist, I guess you would say, psychiatry hospitalist. And that's exactly the type of use case she was thinking of. If someone comes in, especially if she's dealing with inpatients, to be able to see their history of what they tried, what worked for them and what didn't work for them, or, if they're in a taper, how are things going? And even so, mental health practitioners, it seems to me, have more time with patients to potentially help be note takers. That's another benefit I see for this in mental health. And to kind of play the role that I have played, but just to help people capture their stories and not put it all on the patient.
That's a great idea.
Yeah.
I didn't think of it from that point, because it's a very demanding thing if you have to do it by yourself at that level.
Yeah.
Right? Looking at your life history is hard enough, but looking at 3 years of psychopharmacology and what works and what doesn't is a very demanding.
Yeah.
You want some help. Yeah.
Yeah. You want some help. Definitely. It's complicated.
It is.
Yeah.
Thank you.
Yeah, sure. Yeah. So kind of this section is about making someone's whole story easier to understand. And so I like this. This is another kind of simple timeline, one of the earlier ones that I worked on, but I always like it because it reminds me of ocean and mountains and a sunset, and it just kind of pretty. But you can see how this is a good example of like an event, which is the big sun setting. The hospitalization for poison ivy really kind of kicked off a major process, and things just got worse and worse from an autoimmune standpoint. And so this patient brought this to her doctor in New York, her primary care doctor. I've already said this a few times, but this doctor said this is what she tried to do in her head when talking with patients. So just sort of a more reinforcement for this approach of helping to understand the whole story. And so you mentioned mental health, and that is a really important part of someone's whole story. Not, definitely for people where mental health concerns are their kind of primary health issue, but also for everyone else too. And the first few people that I worked with in my template, I didn't have a section for mental health, and people started asking me, why didn't you ask about mental health? And so I added that into the template and started just asking everyone about times of, to put it gently, like times of stress or times of anxiety or depression. And almost everyone has times where they felt very stressed or where they were depressed or anxious. And so we just want to kind of understand that and see mental health alongside physical health and see how the two interplay. So that what I'm showing you here, yellow is depression, and this like pinkish color is migraines. And so for this person, depression and migraines were kind of equally important medical problems. And so it was helpful to kind of map them out, see where they were in sync, or where, how they interplayed. So just because it's interesting to see from a visual standpoint, this is a person with bipolar, which is the purple, and social anxiety. And so this was an interesting kind of problem to try and figure out how to represent the different kind of bipolar episodes. And so you see mood disturbances start, if you can read, that's probably pretty small, but in 1970, and they're kind of less severe. So height is severity, less severe, a little shorter. Then they get more severe, a little longer. And then there's like this worst episode ever. And then since then, these blips once or twice a year. So this, by visualizing bipolar episodes, I think it's an interesting and helpful way to kind of see someone's journey and kind of see where they are now versus where they were back then. Someone else who had bipolar, can you see this okay? Is this pretty tiny? Denny? Oh, I can't hear you. I'll keep talking.
I'm sorry, it's pretty
okay.
small. It's pretty small, but I think if you just point to it and help us through it, that'd be great.
Sure. So the yellow is manic episodes. We decided to separate this one out. So the yellow is manic episodes, and that's above the x-axis, and then the blue is depression, and that's below. And so, like I said earlier, I've been able to kind of try different things out. And so this was another way of seeing when someone is up and when someone is down, and kind of also seeing the severity of episodes and the length of time that they lasted. So you can really see the trend here, how this person has gone from more up earlier in life to more down and more depression. Stress, just another word on stress, that's the yellow bubbles here. So we all know that stress is so important to our health. It's something we read about in the news all the time, and we try and manage our stress. It doesn't feel like it makes it into our doctor visits, into our discussions that effectively. And so capturing stress and really understanding how these moments of severe stress might start, kick off symptoms, or how they might relate to what's going on with our health, has been a really important part of this process. So this example is from one of the veterans who I worked with. So of the 10 veterans, I think we ended up visualizing their work history for most of them, probably at least 8 of them. And that's the gray line that you see across the top. What I noticed in talking with them is their work that they had done gave them a lot of pride. It was very important to their identity over time. And since they were people with memory issues and also other kind of chronic health concerns, often their work had exposed them, or their deployment had exposed them to certain chemicals and fires and things like that. And so to be able to capture those exposures as part of their work, it was important to their physical health history and also to their kind of pride. And people with memory issues who used to be airplane mechanics or just very talented people may not be able to do that job anymore. It was helpful to kind of map this out and understand and really kind of highlight their skills. I bring this one up because in long haul trucking, this person said that he drove truck because he wanted to be alone. And so this was his employment decision was a symptom of his PTSD, and he was isolating. And so this was also relevant to his mental health. So we brought this back to his psychiatrist, and this was like a new insight that they hadn't talked about in the past.
I have another question.
Yeah.
Do you see any correlations between the medical problems and the known side effects from some of the listed treatments? So for example, Topamax has a lot of pretty severe common side effects that could show up as symptoms or how you feel, or hope that the physicians can make those connections. Do you see that? You know, this is kind of the physical version of the mental health question that I asked earlier, but you know, do you see that certain medications not only may provide benefit, but they may actually cause harm, and identify them as such, or at least highlight them as such?
Yeah. So there's a few ways that I think has played out in my experience so far. One is they have side effects and they know that the side effects are, they're pretty sure the side effects are from the medication. And in that case, we can turn it red and say, we really think that the side effect is from that medication. In another one or two cases that I can think of, someone was having mysterious symptoms and they couldn't figure it out, but they were on a lot of different things and they were wondering if it was a side effect of something. So I think being able to kind of line up, okay, when did I start that drug? And just think like, when did those side effects start? Because it may not have been right at that same moment. The side effects may not have started until a little after. But when you can take a step back and see that process of, you know, when did it start and when did the side effects start? I'm hoping that would help doctors be able to figure those types of things out. It hasn't come up a lot, but yeah, it's a good question. So this is an image that I showed earlier in the presentation, and I just like to point out that kind of to underscore the severity and the desperation of people who, or the severity of certain patients and the desperation of not knowing what's going on or not knowing what you can do to help yourself. A lot of times people come, by the time they come to me in the past like 6 months or a year, they've been adding like lots of different things, trying lots of different things. And so there's this like, I called it like the hockey stick of desperation, of like, you just see that things piling up. And it also speaks to, you know, sometimes for very complex people, they are on, you know, and this might be dietary changes, it could be all different types of things, but sometimes people are just on a lot of different medications, or they have been in the past. And so when we think of, okay, how do we represent 80 different medications and treatments that someone has had in the past? So just as like one thing that I've been playing around with is organizing them by purpose, just so that we don't have to look through all of those things at once and try try and find what we're looking for. So this is kind of, the text is gray, but it's, so for example, there's a section for GI and nutrition, for feeling depleted and fatigued, for mental health. And so for each person, these categories are a little different, just as a way of parsing this. And, you know, if I am a GI doctor, it helps me see the big picture, but then like zoom in on the GI meds that they've tried. This is kind of a zoomed out view of a very complex person who I worked with. And so when I've worked with people who take me, you know, it takes me a long time to get through their timeline and to figure it all out and to lay it all out. There are times when I worry. So basically I set up a follow-up call and I present my screen and we walk through this together. And in the beginning, I was worried that if someone saw something like this, it would make them feel depressed about what's going on with them. But I've actually found just the opposite, that there's like this feeling of almost euphoria of, oh my, like, well, okay, so this person said, this is her, names have been changed, by the way, but she said her doctor loved her timeline, it's extremely helpful. But what I want to underscore is she said it shows the work I've done and how I've had to advocate for myself. So when you see like all those treatments and, you know, everything building up, where I see, oh, that seems really difficult and complex, she's seeing, oh, look at how hard I've been working, and, you know, it made her feel better about herself. A similarly complex veteran who I worked with, even more complex with PTSD and many physical health issues, said he didn't have to keep track of this in his head anymore.
We have a comment from our colleague, Barbara Rabson from the Massachusetts Health Quality Partners, focuses on primary care, patient care quality. She says, thank you so much for this discussion. It's fascinating. It makes me wonder if the EHR could have looked more like this if it was designed for patients and clinicians, just as a compliment from an esteemed colleague. I thought you would like to
Thank you.
That.
Yeah, I think there's no reason the EHR couldn't look like this, except for that it was EHR, designed for billing and also stuck in its ways. Yeah, I think there's a lot of opportunity to bring this approach into the clinical setting. And I feel convinced that it would make life easier for doctors in addition to patients. So patients, what I've seen, and with myself and also others, I mentioned there's something about seeing it all in front of you that even though it's complicated, there's this sense of relief. Here it all is. There's nothing, there's nothing we're missing. We got it all. It's all here, and this is our reference and our starting point for our discussion with with the doctor. And so there it all is. There's a sense of relief, and you can, like I said earlier, you start to see these patterns. You maybe start to understand a little bit, not always, but maybe a little bit of why this is happening to me, whether it's from you see how important the infection was to your health history. You see now that it really seems like the major event, or the chemical exposure, or even for me, once I mapped out my health history all those years ago, I noticed that August was like a trouble time for me when I seemed to have flare-ups. And so it's just, by understanding that, I was able to manage myself better and be careful around that time of year. So there's a sense of clarity. And I've worked with a few people with PTSD. And so a person who I worked with PTSD and many health issues said that this helped her to integrate and make sense of her experiences. And I think that the potential for this type of work for people with PTSD to basically kind of understand through visually seeing their health their life story, that the past is the past and the present is the present. It's one of the goals of PTSD treatment. And I think I'm not a clinician and I can't treat people, but I think there is something here that might be helpful for people with PTSD and promising. So. Do we have other questions?
I think we have a few more. One that I have is that there are a lot of places where, one, I think you have a tremendous future ahead of you. I think
Thank
this
you.
is.
My mom will appreciate you saying that.
Yeah, well, I want your mom to know that you are tapping into patient engagement at what I would consider sort of the, unfortunately, born of necessity, unfortunately born of struggle and suffering, but this is patient engagement at the highest level. This is, like you said, sitting down with a shared experience or with a patient experience and with a history that's theirs, as opposed to one that is presented to them and presented to them from a very sort of limited vantage point. Important, but limited nonetheless. I think one of the things that I hope our audience members, I know our audience members will appreciate, is that, one, we want to hear about the app. We want to know how that's going and how soon we can get our hands on it so we can begin to work that through. Another question that comes up is, what about patients who can't remember this for themselves? Do you have a mechanism or future plans on how to extract some data from EHRs, from payers, from my Fitbit or personal health history? Like when I stopped exercising, for example, shows up in my Fitbit record. I can see it reminding me every day that I didn't work out for a period of time. How do you see those other mechanisms that can augment a person's memory being put to use in something like this?
Yeah. I will get to this, but I will speak to it now also. I would, in a perfect world, the health timeline that I've been talking about would be potentially pre-populated with the data that we have from a health record, health data aggregators, maybe claims data, and then groomed by the patient, because some of that information will be wrong, right, like in my case. And some of it will, like you said earlier, some of it will be at such a level of fidelity. I think there's design considerations of how to show the zoomed out story and still get some meaning from it. And so if you get lab tests done, the same lab test done over and over, and it's always the same result. For me, a CBC. My CBC is always the same. I get it done very regularly. How important is that to my whole story if I'm like presenting from a very zoomed out view? I think those are some of the problems that still need to be worked through. But obviously, another example is medication names are really hard for people to remember. So when we talk through their story, they can remember almost everything, and we get really far without actually referencing their health records in a lot of cases. The one place people have a lot of trouble is medication names. So if we could pre-populate those, that would be really helpful. And then when we're pulling in data from systems, we can often see when the medication was prescribed, but often only the patient can tell us if it was taken and for how long. So there's a lot of, I think if we can pull in that data, it would be helpful, a helpful starting point, and then the patient could kind of make it represent their reality. I will talk more about the app as well.
Good.
In a second.
Okay, we'll let you continue.
Okay, so I think the benefit that I wanted to talk about is being heard and seen as one of the really kind of key parts of this work. And so this is sort of an early rudimentary timeline as well, but this one was for a person with endometriosis along with other health issues. And endometriosis is very invisible and often not well understood condition. A lot of women are told it's in their head and not really believed. And so we mapped out her health history. We mapped out her symptoms. She brought these to her doctor. Actually, when she received these documents, she said she broke down and cried because she felt so seen in a way she hadn't before. And she was able to find a doctor who she got surgery and was able to ease her symptoms. So this idea of being seen is something that has come up over and over, being heard and seen. And when I get feedback from people, these are the words that they use. And so I wanted to break that down and understand, what does that mean? And so I think there's a few elements of being heard and seen. And the first is just in the conversation with me. When we take those 90 minutes or so, we go through their whole health history. My job is to ask questions, to make sure we're not missing anything, and to make sure I'm representing everything that the patient wants to represent, and that I've gotten it all. And so unlike a rushed doctor appointment where, just to try and make the best use of time possible, doctors end up asking a lot of questions, interrupting, and there's just not enough time to be fully heard, for the patient to be fully heard. It's not the doctor's fault, it's the system's fault. So having this time to be fully heard by me is the first part of being heard. Then I work on these visuals and put together a draft, and then we get on a call and I show them the draft, and I actually share my design tool, share my screen, and we edit it in real time. And so by showing them the visual that captures the conversation, that shows them that they've been heard and seen, and they also have kind of control over what that visual looks like. And then they're able to take that visual, take it to their provider, and collaborate more effectively and be heard and seen by the provider. So I think there's like multiple steps in this process that are emotionally beneficial in helping people be heard and seen. And this is especially important for people with invisible symptoms. I myself have had many invisible symptoms. I have 2 slides here of people I worked with who they were my art director, and they kind of told me exactly how their body felt and what shape to use here, and what shape to use there, what colors. And so these types of representations, I think and hope, help people with invisible symptoms to be taken more seriously and not just told it's all in their head. If someone takes the time to put together this kind of visual, I would hope that a doctor would take them more seriously. And that seems to be the feedback that I've been hearing from the people I've worked with. So these are kind of some interesting of those examples. So we were just talking about this a bit, but the story, I believe the story does have to come from the patient. You mentioned that the electronic health record has a lot of information about a person. It's often very important information, but it's basically what someone else typed into the system about you at a discrete moment in time. And so there's all kinds of data and information that things we've been talking about, like symptom history, life events, things that happened in childhood before our health records were digitized. They might be mentioned in a note somewhere, but it's often not captured in a structured way. So to really understand the whole history of a person, the patient is the only one who has that story. So to give them the power to use that information and kind of present the story in their way, I think is really important. There's this idea of patients are poor historians, and I've found actually it's the opposite. Patients are really great historians. They just need time to, I think they often need time to kind of cycle through their story and to get it all out. They also need some structure and some help. So when I kind of go through my structured document and ask all these questions, make sure I'm getting it all, the patient has been able to remember most of what happened. Even if they can't remember the exact month or the exact year, they always remember, oh, I had a surgery here, this happened there. So in my mind, it's the most important thing is to get that down versus having it be perfect. And in the VA project, those 10 veterans, we had the doctor rate how accurate the timeline was as compared to the medical record. And for all of them, it was either an 8 or 9 or a 10, 8 or a 9 out of 10. It was never like quite perfect, but it was pretty good. And that's people with memory issues.
So one of the other questions that came through, and I think you touched on this a little bit earlier, is, there are a lot of people who aren't tech savvy and for whom an application will be a difficult thing, either because of lack of familiarity with it or because of accessibility issues due to disabilities, which can also apply to getting on to a video call with you. Mindful of the fact that you're not doing this on a one-to-one basis as much and won't be continuing that in the future. But you mentioned the clinical visit or the visit with a clinician may not necessarily be the physician. It could be a physician assistant. It could be a nurse practitioner. Yeah. A mechanism for someone to be a scribe of the patient's the person, I don't mean to take the word patient out of it, the person's medical history, the person's health history, their experience history. Have you had conversations with practices? The physician said, I wish I had one of these for every patient. My response was, well, what are you going to do about it? That was the question that came right to my mind was, this can't be work that every patient has to do on their own for a lot of reasons. Some can. They are so fiercely motivated and so desperate. But for many who would benefit equally from this, they need help getting this kind of thing rendered in a way that it takes a crowd to document everybody. It takes a lot of people to help a lot of people put this down. Do you see physicians or others in healthcare saying, we would actually put someone in our practice to assist patients in doing this because we know for a fact that our subsequent visits will not result in repeated tests, drugs, procedures, et cetera, or missed tests, procedures, et cetera. Do you see that happening among providers saying, we should have a scribe in our practice working with all of our patients, or at least a subset of our patients for whom this would be an invaluable service, but they don't necessarily have the means or ability to do it themselves? What are your thoughts about that?
I think you hit on something really important, that the patient in many cases just won't be able to do this on their own. And I've seen that too. Even people who pay me have a hard time filling out the intake paperwork before the call. And so having someone in a similar role to me, whose job it is only to capture the story and not to decide what to leave in or leave out, and not to try and diagnose. I think it's very helpful to have someone in a non-physician role do this. And also the physicians I've talked to are like, I'm not the one. It's not going to be me to do this because they don't have the time. So yeah, that idea of a medical assistant has come up, or a nurse, or a role. I haven't yet heard anyone say like, I'm going to do that. That's what we're going to do. But the idea has come up. It's just complicated when it comes to spending that time, when it comes to reimbursement. It seems a little bit difficult to figure out, but I've been hoping to be able to pilot this in an environment where there's already a role that spends time with patients, whether it's mental health or whether it's, a coaching, a program that has like a health coach already or a health navigator already as part of the service, so that there's already, they don't have to come up with a new role and figure out how to get reimbursed and all that kind of stuff. But yeah, in some way. And, for a while I was thinking, does Pictal Health hire a bunch of interviewers to help do that, and that's one path. It is a complicated path, so I'm not sure about that, but there's also the idea has come up for family members to potentially help each other out with this, and help be the note taker and ask the questions, or even patients to have patients help other patients, and that could be like hired or volunteer, whatever it is.
If I was a provider, a physician practice, medical group with multiple providers of different scopes of practice, and I was increasingly under risk-based reimbursement, this would be an invaluable, perspective, not only retrospective, but perspective tool to make sure that I am not, exposing the patient to tests and things that they've had before, both for health reasons as well as economic reasons, that there's a much stronger sense of, population health is really the additive effect of lots of individuals being cared for in a manner like this over the lifespan. So there may be more interest as more and more professionals go under risk-based contracts to have a tool that helps them and provide a role within their practice if they're large enough. Again, smaller practices might do this through a physician hospital organization or an independent physician association, but this could be a service that would be an invaluable tool to navigate, value-based care, where I know what this patient is going through. I know what they've been exposed to. I know what drugs they've been taking and have taken, and we don't have to chart the same path at the patient's expense in so many different ways that we do before. So again, if your mother's on the call, I'm telling her that there are good potential markets out there, and it's just a matter of picking which one you want to start with first.
Yeah, absolutely. And I agree. I think there is a lot of potential in value-based care and just any care environment where multiple people are taking care of the same patient. So consults, referrals, or just team, and it's almost always a team that's caring for a person, some sort of team. And for complex patients who see multiple different specialists in the same system or in different systems, there's just a huge benefit to making sure that I had a doctor tell me last week that for every patient he sees, he puts together a picture in his mind of what's going on with that patient. And the next doctor to come along is going to put together a picture in their mind of what's going on. And it's hard for them to tell if their pictures are the same. So to have a picture that then a doctor could maybe disagree with in some way, or, at least we know that everyone's starting from the same point and has a common understanding of a person, which is hard. It can be hard to get from clicking around in the EHR, for sure.
Absolutely. Thank you.
Yeah. I think we've covered this. There's just lots of data that exists that does not exist that is important, that's not in the health records. So aggregation is not enough. So we talked about Pictal app a bit. So this is basically a way to automate a lot of the manual kind of creating visualization. So especially to automate the visual aspect of this work and create a way for us to turn on and off layers of information. So you could like make comparisons between symptoms and treatments, or, kind of explore and kind of decide what data you want to look at, potentially have views for endocrinology, cardiology, kind of different specialists, and then be able to see the big picture. So this is something that is under development. I am still a bootstrapped company, so we're making progress on this, but hoping to be able to accelerate the development in the next few months. And so, yeah, we talked about this. Ideally, this can be built on a foundation of existing data. So currently, would love to hear from your organization if if you could see a use for this, if you're interested in partnering in some way. I've been talking to all sorts of different organizations in like healthcare organizations, research organizations. And so would love to hear from you if you have any interest in this. So,
well, we'll do what we can to spread the word. And we have one question coming in from Kathy, who asks, Katie, would love to hear if you have explored integrating environmental factors. I think you showed that on one, for example, the moldy house. So I think the answer to that is yes, but do you see that playing a dominant or a significant role in people's experiences, the world around them as opposed to the world inside them?
Yes, definitely. Environmental factors, especially when it comes to things like mold, and I've represented that in different ways. Sometimes it's more of like longitudinal injury, where it's like a red line that is, for one person I'm thinking of, lived near a chemical factory, or for another person, exposure working on oil rigs. That was a veteran. And so there's exposures like that I think are really important, and have worked on different ways of integrating those. That's what I think of right away. Environmental, there are also seasonal things like seasonal allergies that might be applicable to this. And so there might be, if you knew where you were living and you could pull in allergy data from your area, that could be interesting. That starts to get into more of the symptom tracking and sort of the troubleshooting portion of this, which haven't focused too much on, but those are some things that come to mind.
Well, those are the questions that I have, Katie. Do we have any questions from folks in the audience before we stand up our poll? Let me launch the poll and give folks a chance to think about these while they answer the poll. Please take a few moments, those of you in the audience who have access to a screen, to provide us your answers to 2 questions. That's all we ask of you. So we'll watch those coming in. So far, looking very, very good. I'm not going to say 10 out of 10, Katie, because we've been there already. Okay, I don't want to bump up against that 10 out of 10, but we're very, very, very close to that. So we have a few more moments before we get the remainder of folks who are online. We're down to the last few seconds. Okay, thank you all for participating in the poll. And as folks can see, folks don't know, Katie scored just shy of perfection. I guess it's going to be the story of your life, Katie. I mean, these people are going to say it's almost perfect, but there's a couple of things we want to add, but we think it's perfect. We think thanks,
everyone.
This is an awesome thing. One final question. There's a lot of sensitive information in these histories. Do you see privacy concerns in integrating all of this together? And how do you manage those concerns?
I do.
Or how do you address them?
When I've surveyed people about the Pictal app, and one of the biggest concerns is privacy. And so I think because, when we talk about the whole person, we're talking about mental health and physical health. And a lot of times people are especially very private about their mental health or their physical health. We have this new way to see someone's whole story and understand them in a very holistic way, but that also creates vulnerabilities if other people see that, who they don't intend to see that. So from a technical standpoint, building out this app and this service, security and privacy is so important and kind of complicated. And then there was another aspect to what I was going to say. Was there another part of the question?
I have to look again. Let me see. There's a lot of sensitive information, integrating this all together. And what about not sharing all of it with every provider? For example, if you want to go to a provider and say, I'm going to a behavioral health provider, or I'm going to a physical therapist, I don't need to share my entire life story with them, but I do want to share my injury history, my orthopedic musculoskeletal history, but they don't need to see, my psychopharm.
Yeah, that's the idea, is that there would be kind of the everything view, and then there would be a custom view for a specific provider or a specific purpose, or maybe even just like a view that I share with doctors, and then a view that I hold for myself that has a little more information. And I have definitely found that even working with people, sometimes they'll have me make a separate version that omits a few things, because maybe they're sensitive, and if they're trying to troubleshoot their autoimmunity, they may not need to go into some of their childhood trauma or whatever it is. So yeah, I think that is really important, to be able to customize the view of the story for the situation. I remembered what I wanted to say when it comes to privacy and security. One thing, I wouldn't want this to be weaponized, so to speak, against a patient. So if, for example, if an insurer were to use this type of view in order to deny treatment, that would be kind of a worst case scenario for me. So I don't know what the likelihood is of that happening, but I know insurers are often that is sometimes their goal, is to deny expensive treatment. So no offense to any insurance people on the call. So I think there's, I would just I'm trying to keep in mind moving forward and anticipate any possible ways that this could be misused against patients, and try and prevent that from happening.
Good. Yeah. Well, Katie McCurdy, thank you for a fantastic discussion. We've had nothing but really positive comments. I think the questions that came from folks were great. You should also talk to Apple, because they have the Apple Health app, and this can stay on a person's device. This does not need to be made part of a third party's electronic medical record. It can be shared, and maybe shared temporarily, briefly, and then permission withdrawn. But that's always a discussion for another time. But I want to thank you on behalf of MHDC, our members, and our community for joining us today. This is fascinating work. All of us have in our mind that we wish we had something like this. I can certainly speak for myself in saying that to see one's life rendered in this way does not create a sense of concern. It actually creates a sense of a real story, and a story that we often don't know ourselves until we see it laid out in front of us. And that's a story that we need to know if we're going to share it with others. So I don't know if you have any final parting thoughts for us before we adjourn, but I'll ask you to share any final comments you might have.
Final comment is, there is, I think, also a use for this kind of thing in end-of-life care, and understanding and communicating not only your health history, but your life story, and capturing that and giving that to your providers, but also your family.
Yeah.
So I think there's an interesting, and I have had some outreach from hospice groups about that kind of thing. So that your prior comment prompted that. But thank you so much for having me. This was wonderful. And thanks everyone on the call for your questions.
Well, thank you, Katie. And if I have any further questions, we'll shoot them to you offline and allow you to communicate with the person who sent them directly.
Okay. Perfect.
And thanks to all of you who joined us. Stay well and safe. And again, thank you to Katie McCurdy and Pictal Health. And we're adjourned.
Thank you.